All right, we are ready to go. So, what we're going to do today for the final class meeting is we are going to see the conclusion of the movie White Dog. So we saw the first third of the movie. Now we're going to go through the treatment of it. But you were asked as a challenge, as they kind of put you in the shoes of a clinical psychologist. We saw the behavior of the dog. It was identified as an attack dog. Clearly that's the behavior that is going to be treated. But it's also clear that this dog was reinforced for being an attack dog. It was trained for being an attack dog. And it doesn't attack everybody. There's a discriminative stimulus for reinforcement. A stimulus that says, when this stimulus is here and you attack an individual, you will be reinforced. When the stimulus is not there and you attack an individual, you will not be reinforced. And the dog has learned to attack individuals when the stimulus is there and has learned to not attack individuals when the stimulus is not there. So the challenge posed to you was, what is that discriminative stimulus for reinforcement? And there's two separate ones, which makes it a little bit more difficult because there's not one stimulus that will account for all the situations of an attack in this movie so far. So there's two. So any suggestions about what that discriminative stimulus might be?
Flashing light.
So flashing light is one suggestion. So there were flashing lights many of the times when the dog attacked an individual. Yep.
It's loud, like noises, I guess.
Loud noises is another possibility.
I wasn't completely sure, but I thought maybe if someone was wearing like a hat or like a coat or sunglasses, something like that.
All right, hat or a coat. Yep.
I was thinking maybe the color red.
It could be the color red. Is the discriminative stimulus for reinforcement? Any other guesses? Yep.
More of a clicking noise, like the camera shutter or the guy striking a match.
All right, possibly a clicking noise. Yep.
When the owner seems in danger, when it seems like the owner is in danger.
Okay, so somebody aggressing against the owner.
Yeah.
That's another one. Yep.
Skin color.
All right, skin color is another one. Any other suggestions? Okay, so based on the behavior that we saw the dog do, we have come up with 7 plausible possibilities, right? So this is 7 possible discriminative stimuli for reinforcement that this dog might be operating under, and 2 of them are right. But this just kind of gives you an example of the difficulties that face a clinical psychologist, somebody working in the real world. In a laboratory, we set up the conditions. We know exactly what the discriminative stimulus for reinforcement is. In a real-world situation, not so clean, so we have to try to piece it together and see what it actually is. So one of the ones that was correct was aggressing against the owner. So in 2 of the instances, one being the rapist, when the rapist was attacked, and 2, when Julie's boyfriend was almost attacked, when he was saying, I'm going to call the police, and then the dog started growling. Those were 2 instances where Julie was being attacked, was being aggressed against, and the dog was about to attack and be reinforced for it. And the other one we'll see right now. All right, discriminative stimulus for reinforcement number 2 is skin color. So this is a dog, this is an attack dog that has been taught, and you're going to be given the background story towards it through classical conditioning, through operant conditioning, has been taught to attack black people. So the discriminative stimulus for reinforcement is skin color. Black skin color, reinforced for attacking. Not black skin, not reinforced for attacking. And now we're going to see what it is that, how it is that this dog is going to be treated to undo that training. So this is, again, our discussion on ethics. You're going to see a lot of stuff that we have previously seen, operant conditioning, extinction, intermittent reinforcement, all those kind of factors. But again, this is a very clear case of an unethical decision by the owner. So the owner made an unethical decision, did not take into account beneficence, used psychology not for good, used psychology for harm. Did not take into account justice, did not use psychology so that all people can benefit, use psychology against a very specific group of individuals. So broke those ethical guidelines, and we've already seen harm because of those ethical guidelines. So we already have one person murdered, one person mauled, and again, if those ethical guidelines were not broken, none of this harm would occur. So the power of these guidelines to keep things from harming, from psychology, from harming individuals is going to be very, very clear in terms of the treatment of the dog. All right, so this is a nice example of the first part of the treatment. This is an extinction procedure that they're going through right here. So previously, the dog would be given the discriminative stimulus for reinforcement, which would be a black individual. The dog would attack. The dog would get reinforced by the black individual either being immobilized or being killed or being taken away. In that case, that would be the reinforcement. What Keyes needed to do was he needed to present that discriminative stimulus for reinforcement without the dog being reinforced for the attack behavior. So by tiring the dog out and now presenting that discriminative stimulus for reinforcement, he has gone through an extinction procedure where it's like, here's the discriminative stimulus, but you're not being reinforced for me going away. You're not being reinforced for attacking me. Also, there's an element of classical conditioning here, because the dog has been classically conditioned so that African American people have become a aversive stimulus. He has gone through training where he first learned to escape a black individual and then learned to avoid the individual by attacking them first. Now what Keyes is doing is he's presenting that conditioned stimulus with no unconditioned stimulus, and we're going to see the unconditioned stimulus was pain. This dog was beaten. Now he's presenting it with no unconditioned stimulus. The dog is too tired to escape. Therefore, he can present it and decrease it and try to change it into a neutral stimulus. But as we've seen before, once a stimulus becomes a conditioned stimulus, even though extinction takes it to a neutral stimulus, it's not really the same neutral stimulus that it was prior to training. All right, and this is just my little public service announcement for mental health professionals. If you do hire a mental health professional and seek their advice, try to follow what they say. So Julie's like, oh yeah, he's not going to attack me. I know this dog. And Keyes is like, no. Get into the cage. So just my little aside.
Really?
All right, so that's the classical conditioning aspect of it. So when this dog was a puppy, what they did is they would have a black individual beat that dog. So that put that neutral stimulus of black skin together with the unconditioned stimulus of pain. After repeated sessions, after repeated presentations, the neutral stimulus turns into a conditioned stimulus that causes the conditioned response now of fear. The unconditioned response for pain is fear. Now the conditioned response to the conditioned stimulus becomes fear. You can then use the removal of that stimulus to negatively reinforce the attack behavior later on. So once again, we see that in when we were learning about punishment and escape and avoidance. The dog first learned to escape the situation, and then it learned to avoid the situation. So even though it hasn't been beaten since those training days, it now has learned to completely avoid the situation by attacking before it is attacked.
Without surgery?
All right, so at this point, this is where the first ethical decision needs to be made in terms of progressing with this procedure. So, do you do the procedure, do you don't do the procedure? What you want to do is you want to weigh the pros against the cons. So, basically have two choices. They either treat the dog or they euthanize the dog. If you euthanize the dog, then there's absolutely no risk to anybody else. Nobody else is going to get attacked, nobody else is going to get killed. However, so that's minimizing the risk. However, you get no benefit of learning how to undo this type of conditioning, so you have no deterrent for future racists breeding these dogs. You have no way of treating any other dogs that are out there. So you minimize the risk, but you lose all of that benefit. For others, on the other hand, is saying, look, there is a risk. There is a risk in keeping this dog alive. But the benefit, it far outweighs that risk. In the case of the benefit would be to have a foolproof method that he can then publish, he can then go public, and anybody who has a background in animal training will then be able to untrain these dogs, which would hopefully act as a deterrent for people not to spend years conditioning these dogs if they knew that within a matter of months they could be untrained. So ethical decisions always need to balance or consider the benefits and the risk. You want to maximize the benefits, you want to minimize the risk. And ethical discussions are often tied into how do you value one more than the other. So those types of gray areas are where people will differ in terms of, was Carruthers right to say, yes, let's treat this individual, this dog? Was Julie right to say, no, let's euthanize the dog? Those are the types of things you consider to make that ethical decision. All right, so I'll pause just one more time. I'm doing a bunch right now. This boomerang effect. You could try to stretch and say that maybe it's experimentally induced neurosis, right? That experimental neurosis that we talked about earlier. But this is, in my mind, the only really non-scientific part of the entire training procedure. So that boomerang effect, don't let it derail you. Don't try to make too much sense of it. I think that was added in for dramatic purposes. All right, differential reinforcement of other behavior with extinction. You aggress, you don't get anything, but I don't go anywhere. That's the extinction procedure. You're nice and calm, you get a hamburger, differential reinforcement of other behavior. In this case, incompatible behavior. So what Julie just did was she just put her dog on an intermittent schedule of reinforcement. She just taught the dog that it can aggress as much as it wants to against Keys, but then whenever she comes around, it will get reinforced with a hamburger. That's an intermittent schedule of reinforcement. Those are much harder to go through the extinction procedure. So Keys is rightfully angry because she just set him back a whole bunch of progress. All right, so at this point in the movie, this is where Keys, I believe, kind of becomes morally ambiguous, ethically ambiguous as to whether or not he's really taking into consideration these ethical considerations. So at this point, I think it's required to mention, clearly we've crossed legal boundaries. So they are now not reporting a murder. They are now harboring a murderer. So there clearly is that legal, what they're doing now is illegal. So we'll set that aside. In terms of ethical considerations, though, this is the first indication that we have that Keys might not be considering the risks that are involved in his particular procedure. Because rather than saying, well, let's reassess what we're going to be doing here, let's reassess if the risk is worth the, the benefits, he just sounds like he's just going to plow ahead. And it's like, I'll get another one, and another one, and another one, and another one. It doesn't matter how many. So this is where we kind of don't know if he's really trying to be an ethical person, make ethical decisions, because it's not clear whether he's weighing the pros and cons anymore at this point. Even though he definitely identifies the knowledge and a procedure to eradicate those dogs as a big pro, we're not sure at this point whether he's properly weighing the cons of that procedure. All right, Keys knows about spontaneous recovery. He knows the dog will not necessarily remember this tomorrow. Good. So what Keys is talking about there is stimulus generalization. So he's gone through extinction for one conditioned stimulus. Now he wants to see, has that extinction generalized to similar stimuli? All right, so just to kind of reiterate why we have ethics, that trainer, that owner, one bad ethical decision, right? To train this dog didn't take into account beneficence versus maleficence, did not take into account the principle of justice, and everything that came as a result of that, all the harm that came as a result of that came from that one poor ethical decision. So ethics really it's a powerful way of protecting us and others from the harm that psychology unfortunately can create. All right, so that is the end of the movie White Dog. So you can see one unethical decision led to at least 2 people dead, at least 2 people maimed, and 1 dead dog as well. So this idea of harm and protecting people from harm, protecting psychology from harm, protecting the scientists from harm, that is what ethics does. And this should have been a 2-minute movie where they just did the dog's backstory and the racist individual would have said, you know what, should I train this dog to be a white dog? Well, that's not for the greater good and minimizing harm, and that's not justice for all people, so no. And then that would have alleviated and prevented all the harm that occurred afterwards. So we got a few more minutes before the end of class. Any questions, comments about ethical decisions or the movie itself? All right, other than that, that is it for this semester. So I will see you all for the exam on exam week. Double check Tuesday or Thursday, because I got a few classes floating around. But other than that, we are done for the day.